Good afternoon, everyone. My name is Gina Rodriguez, and I want to make sure that we are live and that people can hear me. So I'll give people a second to get acclimated. Again, my name is Gina Rodriguez. I am the project manager for the Community Health Training Institute. If you are here for Preparing for Policy Change, What to Expect at Municipal Meetings, a webinar led by DJ Wilson, you are in the right place. Welcome. We are so excited to have you here. We will be running this webinar from 2 until 3:30. And in a second, I'm going to hand it over to DJ. But I wanted to let you guys know a little bit more about how this webinar is going to be run. And you should be getting something, a chat sort of from our coordinator, Kelly, to just make sure that no one's running into technical difficulties. And if you do, feel free to chat her and ask questions, and we'll make sure that we get you the help that you need to make sure that you can hear and see the presentation as we move along. But this is how this training is going to work. If you have any questions throughout the webinar or this online training, we ask that you put them in the question box, and those questions will come directly to us. If you have a chat that you want to share with all the attendees and us as well, we want you to put those in the chat box. And there are several ways that you can sort of interact by raising your hand and, again, asking questions and submitting chats. And we'll want to make sure that you are staying engaged as well. We have some polls and some questions that we'll be addressing to the audience. Again, we're really excited to have you here. All of the trainings that we host here at the Community Health Training Institute are absolutely free thanks to the funding of the Massachusetts Department of Public Health. Again, if you have any issues, please feel free to chat and or question us, and we will make sure that you get all the information that you need. All of the slides that we'll be going over today will be sent to all the attendees of this webinar, along with the recording of the webinar as well. And again, if you have any questions, please contact us. If you are on social media, please tweet us at HRIA Institute, and our hashtag is MA Coalitions on Twitter. Again, all attendees will be muted. We ask you to make use of the question box and the chat function and raise your hand if you need any attention from us at any point. But I think that is it for us. And I will hand it over to DJ in 1 second. There we go. Perfect.
Should I start it again?
Yes, please. Okay. You're muted. Go for it.
I am. My name is DJ Wilson. I am the Tobacco Control Director and Public Health Liaison at Mass Municipal Association. We're a membership association. I'll talk about that in a minute. Just one note: I am at the start of a cold, so undoubtedly I will cough, sneeze, and/or blow my nose during this. Sorry to tell you. So the objectives today are to talk, to understand how to deal with your local government, and we'll also be talking at some point about state government, and dealing with stakeholders, community members, and your elected officials or appointed officials to make policy systems and environmental changes in your community. Ways to use your local data and your community voice in town meeting spaces or town hearings, and name strategies for presenting at a town hall or board meeting that will be helpful to have to get your point across. Oops. So the first question is, are any of you currently or previously elected or appointed officials?
And we're asking participants to type that into the chat box. Great. Looks like we have a city commissioner from Madison, Kansas.
Oh, very good.
All right. Great. And we have someone from the Board of Health for the County Health Department. Great. Thank you guys for typing those into the chat box.
So for out-of-state attendees, we'll be talking about a lot about how cities and towns are made up here in Massachusetts and the laws that help us put into local policies. I'll try to be broad and remember that we have some people on the phone not from Massachusetts. Interrupt me if I'm not being clear. I can talk too fast, and I can also kind of whisper when I have a cold. So, and feel free to ask questions if you have a unique circumstance in your state that you want to discuss, and we'll do our best to figure that out. So I started off by saying I'm from Mass Municipal Association. We are what is generically called the State League, and we're a nonprofit that represents city and town local officials. So in our instance, we are mayors, city councilors, town selectmen, town and city managers, and we have a couple other smaller groups. These kind of leagues actually exist in all states except for Hawaii. So this may be a municipal league may be helpful to you in doing the work that you're aiming to do. So years ago, Tom Frieden, who was with the CDC and prior to that was the Public Health Commissioner for the city of New York, came up with this health impact pyramid. And this is something that we do recognize as being a very effective picture as to why we do what we do. So all parts of the pyramid are important, but what we are working on is down at the bottom, the broadest. So we have the largest impact at the bottom of this pyramid. So at the top, I'll use tobacco as an example because that's what I do most of my work in. At the top, we certainly want people to we want to prod current smokers to call our quit line and go for counseling and try to make a quit attempt from tobacco use. That would be at the top. It's a one-on-one intervention, and we certainly see the value in all that. But at the bottom, that's what we do. That's what we've had in Massachusetts, making restaurants and bars and workplaces smoke-free. And so even if tomorrow, well, actually, our state law has been in place for so long that the governor is different, most of the legislature is different, and it doesn't matter because it's already put in place. And people come to expect in Massachusetts to walk into a restaurant and have it be smoke-free. And in fact, people are quick to complain if the opposite is true. In fact, a friend of mine who works in tobacco control sent me a picture. She was in Nashville, sent me a picture of an old-timey tobacco vending machine, cigarette vending machine, complete with the big old pull-out things that you used to have to chunk, chunk, mechanically get the cigarette out. And so that was in Tennessee. We don't see those in Massachusetts. But once you get rid of those vending machines, then they're gone for good. So that is one of the reasons to do this policy and environmental change, because people won't make their changes to their own behavior very easily. But if they have something in front of them that causes them to gently be forced into complying, then that's when we see a lot of change. So what is policy? There's multiple meetings. Generally, it's understood to be a system of laws or regulatory measures at the local government level. I should just, as a note, we learned that somebody is on from the Board of Health at the county level. Massachusetts has counties, but they're only really used for sheriff and court. Yes, where we get our jury instructions from. But other than that, our counties are very weak. But a lot of this has to also do with the county level government. So generally it's laws. So we think of like a city or town that it's an ordinance or a bylaw is the highest form, but then there's all kinds of regulatory measures. There's school handbooks, there's parking guidelines by a city or town, how to do your recycling, that kind of thing. They can be voluntary, such as a worksite wellness policy, or they can be mandatory, such as they say no smoking or drinking in a park and the park closes at 11 o'clock, those kind of rules that are set out in different ways other than being city council or town meeting adopted. So there are a couple of types of municipal policies. A resolution is an expression where this, an example would be a city council decides that next week is public health week. There's no force of law, but it can be an important first step in creating a law. So we've seen this happen in Massachusetts where, you know, something that's maybe the community's not ready to do on a local policy. Let's say you have a youth group go forward and say that, you know, our dream is to, we someday want no cigarette sales in the city, for example. That you could maybe, that's a big lift, by the way, but you could go to your city council or your select board and have them do a resolution that has no force of law, but it does put everybody on notice that that this is what the government would ideally like to see. A local law is what we all know, and they're passed by local legislatures. And in Massachusetts, the Constitution allows cities and towns to pass a law that on any subject that is not completely overtaken by state government. And also, we are unique out of the 50 states to have a Board of Health in every one of our 351 cities and towns, that under Mass General Law, Chapter 111, Section 31, they can pass reasonable health regulations. So why focus on local change? Institutionalizes change, just like I said about being smoke-free. You know, you hear it all the time when people in Mass, because of my job, they come up to me and say, oh, I just got back from New Orleans. I can't believe there was smoking everywhere. And it's because we get very used to not having that happen. Evidence-based, a little asterisk for this. Evidence-based is very helpful, obviously, to be able to stand up in front of, especially a health board, and say, this is the public health rationale for doing what we're doing. But I will say sometimes you are put on the edge of not, you know, you have a town that wants to do something that's edgy and there may not be any evidence base to it because nobody else has done it. So in the early days, actually, when we had a youth group in the city of Gloucester want to get rid of vending machines, they were the first to do so. So there's no evidence to do it, but sometimes it's just common sense. And also it's population based with a broad scope, so it affects everybody. And why at the local level, they're a little more effective because they are easier to pass procedurally, especially using the Board of Health route in Massachusetts. You don't usually get opposition from professional lobbyists. I have here, except for tobacco regulations. I should say, except for tobacco regulations in big cities. So like the city of Boston, we will see the same lobbyists that darken the doors of the Massachusetts State House will come to a public hearing for the city of Boston, but we don't see them in our other cities and towns. It's just too hard for them to get out to, you know, we have a lot of towns that are, you know, under 20,000 people. So we you know, they're just not going to show up for those. And generally, local laws get broad community support because people do think that, oh, this is a direct response to the residents of my town, and this is something that's good for my town. And compliance rates are usually higher because of local enforcement, and also because a local, you know, for example, a local store selling tobacco doesn't want to get in the face or be on the bad side of City Hall. So that, you know, they have to deal with City Hall and a bunch of other things, and they just want to keep the peace. So there are broadly 11 key elements to policy work, and you can see them here. Shared vision. Doesn't help, you know, it doesn't make sense to go to a city town. We have absolutely no support. A community assessment and information gathering, it's helpful to figure out where your city or town is at. It doesn't make sense to call a city a food desert if you don't know that they have 4 supermarkets and 5 square miles. Coalition development, getting some local people around the table to help you with your goals. Policy education, really know the policy inside, backwards and forwards, because a lot of local officials, you know, they dance between a lot of different issues in their day, and so they just generally aren't experts on one subject. But they, you know, city council might in one evening go from parking to tobacco to bond bill to talking about a new school roof, and so they're all over the place. So they do rely on people coming to them with being able to understand the policy inside and the issue inside and out. And community education. Educating decision makers, I talked about that a little already. They, you know, and we'll talk a little further about that. Opposition research, understanding who will be out against you. Obviously, in tobacco world, to figure out who would be against you. But we do have we have a city in Massachusetts that recently banned the sale of nips of liquor, and so it was interesting to go to that hearing and see some of the similarities to tobacco, but also to hear some of the other concerns by liquor stores who didn't like that. So sometimes the opposition research, a lot of it can be done on the web, but sometimes it is helpful to go to a public hearing in another city or town if they are working on a policy that you're working on. Media outreach, it's obviously very good to be friends with the media. And if you're in a smaller town, if you're in a small town that has a small daily newspaper or a weekly newspaper, in general, if you make friends with those people, they're more than happy just to let you write the article sometimes and put it in. So making friends with the media is very important. Understanding your compromise options. It is easy to go in and think to yourself, I want it all or none. Like this is the way it's going to happen. I just was at a meeting this morning and we were talking about, again, it was a tobacco issue, that would leave convenience stores with plain flavored cigarettes to be sold. And someone rightfully brought up the argument that, well, that's the tobacco product that's used mostly in the nation. But you have to be able to understand that that's a compromise. We don't have any city or town in the United States that has banned the sale of tobacco completely, so we're already starting at a compromise option. And the particular city that's entertaining it also has some other compromises in their head if it needs to happen. Public hearings, great to get people out. We'll talk about later about some even just getting people out to say their name and that they're for it is oftentimes a big deal for local officials to hear. And then post-enactment strategy. You want to be able to make sure that you're keeping tabs on if your policy gets passed, to make sure it's going to be the post-enactment strategy is clear, that the people it's going to affect know it's going to happen on a certain date, and then have good enforcement afterwards. So how many of you have, this actually gets cut off on my thing. Oh, I can look up there. How many of you have met with any or all of the following elected officials? And they are mayor, city council, town selectmen. You may have a different version for that if you have county, health director, or school superintendent.
There we go. So we've launched the poll, so feel free to click on the one that applies to you. If you've met with any of your mayor, city councilors, town selectmen, health directors, or school department, click on it and we'll give people a chance to answer the poll, and then we'll close it and see what the results are. All right, a few more people. All right. Yeah, we have lots of comments, people meeting with superintendents of schools, mayors, all of the above.
Well,
our town changed from select men to select person. So those are coming in, and you can see the percentages on the screen as well.
Very good. It does make sense that the one that was least was town selectman, because especially for people who are from out of state are wondering what a selectman is. So it's all right. So if you're new to policy work and working with local officials, I do recommend, I did a webinar last year, and I'm guessing that the powers that be will let you know how to access that. And it includes information about city and town government structures. Remember that local decision makers go beyond just mayors, city councils, and selectmen. And in fact, a lot of times in bigger cities, you'll almost always meet with a mayoral aide. And you'll think you're saddened by the fact that you didn't get to meet the mayor. But in fact, the mayoral aide may have as much pull as anybody, or the chief of staff may have as much pull as the mayor itself. City councils and selectmen. It is important to engage with boards of health and other municipal committees and staff. In fact, I think sometimes the first knee-jerk reaction when people say there ought to be a law is to go to the city council, mayor, or a select board to pass a bylaw in towns. But in reality, sometimes you may want to sit back and reassess that and think to yourself, oh, that's actually something the Board of Health could do, or the Parks Department could do, or it could just be a DPW rule. It doesn't necessarily need to go through the formal process and longer process of ordinance or bylaw making. So in Massachusetts, we have 351 cities and towns. 56 of those are cities. 55 have mayors, 1 does not. Towns, 295. And then we have, as I said earlier, we have 14 counties, but they are, except for Cape Cod, which is Barnstable County, and Franklin County, they generally don't do a whole lot of governance other than courts. So in a city, it's passed as an ordinance here in Massachusetts. It was the Home Rule Amendment to the Constitution allows that to happen. Once the city passes something, it's good to go. Town bylaw, for some reason, our forefathers here in Massachusetts didn't trust towns like they do cities. So after a town meeting votes in a bylaw, it has to be approved by the Attorney General first before it goes into effect. There's some benefits to that because sometimes we're not 100% sure. For example, like if a tobacco, it's just nice to have that stamp of approval where most of our tobacco issues here in Massachusetts are done through the health regulation route. So the few towns that do it by bylaw route, it's nice to get the Attorney General's blessing on something that we've been working on. And executive orders last. Executive orders exist both at the mayor, governor, and presidential level. They typically only last as long as that person's term is going on. Sometimes they extinguish automatically, and sometimes the successor needs to get rid of them. So we do have some as Gina was saying earlier, her board of selectmen has now switched to the gender neutral select board, and we have a lot of that happening in Massachusetts. Same thing with city councilors, going from board of aldermen to city council. They do the same thing. But the reason for telling you these two things is these two things matter when you're talking to them. Do not be in a city that has aldermen and call them a counselor. They'll know you're an outsider and they'll take it personally. Then we have most of our cities and most of our towns have a professional town manager, but there are different types of town manager. This goes down the list of power. Town manager has the most power to appoint and hire. Town administrator is next down. Executive secretary further down. Administrative assistant really is just the assistant of the board of selectmen. And then health, and for health boards here, we have health directors, health commissioners, and health agents. The commissioner is the one that stands out. We have a couple of cities that have a single commissioner who technically could write a health regulation themselves and put it in place, but they typically don't for political reasons. And then health directors have generally a broader amount of education than a health agent, but the health agent is the one who does a lot of the grunt work out in the field, restaurant inspections, Title V septic systems, that kind of thing. A mayor's a mayor, and then the colonial selectwoman story, and this is one of the reasons it's nice to go away from board of selectmen into select board. I was on an elevator with an elderly woman I knew she was a member of the board of selectmen in a small town just outside of Boston. I said, "Oh, how do you like being a select woman?" And she scolded me and told me that the colonial forefathers told her that she is a select man, not a select woman. So it'd be nice to get away from the gender part of this. City and town clerks, make friends with them. It is really important to make friends with them. They are the keeper of a lot of official and unofficial records. They know a lot. They know where the bodies are buried. They really do. And a lot of them are in charge of setting up city council meetings and the agendas. And they are just a real good source of what's coming up around City Hall or Town Hall for committee meetings, commission meetings, and the like. They are, a lot of them have been around for a long time in their city or town, and they really do know what they're talking about. So it is helpful to make friends with them. Transparency in Massachusetts, we have the open meeting law. This means that all meetings of a governmental body shall be open to the public, and any person shall be permitted to attend any meeting. So in Massachusetts, a board of health cannot meet in apartment building. They can't. The doors need to be accessed. The public needs to be able to hear and see the proceedings. That is by law. And it is not uncommon that we, at any given time, have probably a dozen local officials who are being reviewed by or reprimanded by the state for having broken the open meeting law. Then public records law, everything that's written is kept by a city or town, and that includes emails. And so one thing about that is a word of caution. If you are working on a policy and you want to talk to somebody in city or town hall about something delicate, it's best to call them on the phone rather than put it in writing. Then Freedom of Information Act is actually a federal law that allows any citizen to access written information or email information that is being held by a city or town. And so we've used this actually in the past here in Massachusetts under a previous governor years ago who was very timid when we would find out when departments would do some really fine work on tobacco control issues, then he wouldn't let them be given out to the public. And so we have a private entity in Massachusetts that works Tobacco-Free Mass, and they would FOIA. That's the term, and it's actually a verb. They would FOIA the state for the information that they want to see. But be aware, at any given time, you could be, if you send something in writing that somebody else could, if you send something in writing that went inside a city or town hall, then somebody else could request that from them. So just, any questions so far?
So as you were talking, there was a question. Someone was curious where they could find your previous webinars that you've done with us, and those are available on our website. We have a whole webinar library where they can find not only the pre-recorded that you've done for us, but also from the past 2 years, all the webinars that we have. So that's hriainstitute.org if anybody is curious and wants to go back and check it out. And so if you have any questions, please type it in the chat or question box, and we'll make sure that we have DJ answer those questions live. We'll give you a second, but yeah, feel free to go along. If questions come along, I'll pop in.
So foundations of an effective policy. You need a clearly defined issue or a problem. If it's not a problem, cities and towns aren't going to really want to deal with it. My particular city, for example, state of Massachusetts has a law that gives a lot of wiggle room to developers to build condos and apartments if the city or town does not meet 10% of, if they have less than 10% affordable housing in their city or town. So in my particular city, we were the first to actually hit that 10%. As soon as we hit the 10%, there was an entity in the city that was trying to get more affordable housing. But the problem went away because the city, while everybody would think, oh no, the more affordable housing, the better. But as soon as the city met that 10% threshold for affordable housing, the problem would seem to go away. So you have to decide, maybe we should go on with this or just won't go anywhere. Strong, credible documentation of an issue of a problem, great. The more local that documentation is, the better. Evidence-based, also local best, or within the state you're working in. Past experience, so you have an understanding of how city and town, you have an understanding of how city and town hall works, but also the past experience of the body. So it is not uncommon, for example, in Massachusetts, for people who belong to a town that has town meeting, they don't enjoy having somebody bring up every town meeting, getting rid of plastic bags, for example. If they said no in the spring, they're going to say no in the fall. They're not looking forward to wasting this time every single town meeting season. So you do need to sometimes regroup and figure out a way to hit the problem differently. Diverse, broad-based community support is obviously very helpful. And as I said earlier, just getting random residents out to a public hearing that say, hi, I'm DJ Wilson. This is my address. I support this. Oftentimes, that's all it's needed, because you'll be talking to elected officials especially ward councils who'll, be like, oh, they live on that street is in my ward. I have to pay attention to this. Feasible objectives and goals. And one of the problems that we run into, especially in tobacco, is feasibility sometimes, unfortunately, means whether or not it'll end up in a lawsuit. A big city like the city of Boston has no trouble taking on a lawsuit, but a lot of smaller cities and towns will be freaked out if they get a cease and desist letter from a law firm after they put a policy in place. So you do need to think that through and have that. And sometimes you might have a frank conversation with that city or town about whether or not they want to move forward if there's a threat of a lawsuit. So what is a valid policy? Evidence-based is best. Hot topic in the news, upskirting I put in there. The average bill in the Massachusetts legislature takes 6 to 7 years to be enacted, if at all. And this was an interesting thing that all of a sudden there was a rash of upskirting, people taking photos of women's skirts, and because it was so hot that the legislature acted like in 4 weeks, going from from news story to state law took about 4 weeks. So sometimes if you can ride the wave of the hot topic, that's great. And sometimes riding that wave is not necessarily favorable. It sounds awful, but if your issue is bike safety and someone gets killed on a bike, then that may matter more to the legislature or to a local government body to act. Do your research. Obviously, on the internet is a great place to go. And not only that, but most likely you are working on an issue that somebody else in the world has worked on. For example, banning single-use plastic bags. And further to that, entities do exist nationwide. And so a lot of times if you just do a Google search, you'll find entities across the country that do work on your issue. And is what you are doing preempted? So preemption means that a higher law prohibits a lower body to act. So for example, the state of, while in Massachusetts we enjoy broad anti-preemptive law on tobacco, cities and towns in Connecticut can't pass a lot of local tobacco laws locally. Why? The tobacco industry got to the legislature and tagged onto a bill that said cities and towns won't do this. And so a lot of times the industry will do, industries, not just the tobacco industry, will do this because they don't want cities and towns to go further than the state law. And so you want to make sure that you aren't preempted from doing so. In Massachusetts, again, cities and towns are preempted from putting on a sales tax of their own. Municipalities can't do that. So while we have oftentimes people say, hey, how about a cigarette tax just for the city of Worcester? It's not possible. Worcester is preempted from putting in their own sales tax. It's a state level issue only. And as I said earlier, somebody has worked on the issue you were talking about. It probably isn't super unique, so unique that no one's done it. So poke around, and even if you find people who've worked on this policy and it's failed, they still may be good to talk to as to how they got up and running and where they saw that what went wrong might be helpful to you as well. Educating local officials, identify key supporters, learn their biographies. This is so easy today than it was when I started my job 24 years ago. All you need to do is go to Google, Facebook, Instagram. Every local official who is under 75 is on all these platforms, and they know to use them. So you can learn a lot from these people, from those biographies. And sometimes the biography is very helpful. We were just talking earlier before we started about legalized marijuana in Boston, in the state of Massachusetts, and how Boston is slowly opening up marijuana retail shops. And part of that reason is the Mayor Walsh of Boston is a recovery alcoholic. So he takes substance abuse really seriously. And that's the kind of thing that if you learn local officials' biographies, you'll find those things out that they could be very helpful to you. One-on-one meetings is best. We'll talk about that later. Bringing in a resident with you if you aren't a resident is really most helpful. And residents get nervous, like, oh, you want me to come to meet with the mayor? What am I going to say? A lot of times just telling the residents to tell their own story. To tell the story that, there's plastic bags in all the trees around their house and they want them banned. Involve key people and update and inform and become the go-to person on the issue. I used to say you want to be the person who, in their Rolodex, they look you up, but most people don't know what Rolodexes anymore. But you want to be that person who they think of tobacco and they call me. You want that to happen. And so sometimes it's just it's not so much convincing on the first time you meet with a stakeholder to do your bidding, but to start a relationship and let them call you. So this sphere of influence is helpful to look at, and there it is. So it talks about, in the middle, this is the person that you want to convince them to do to work on your policy to approve it, and so these the blue circles around are the different ways that you can do so. And there's no reason that you can't do all of them, especially when about half of them are something that you can just go online and look up. So financial supporters, by the way, if you're in Massachusetts and dealing with the legislator, registered lobbyists must reveal who their clients are and who they support. So it's an interesting thing at the state level. It's not true at the local level. But all these things you can give a look at, and you can really just brainstorm yourself as to ways that you can find a lot of this out. Any other stakeholders that I am missing? If you think about it, send it on. So in Massachusetts, here are these membership associations, if you're working at the local level, that are good to know. I already talked about what MMA is. MAHB are Board of Health members. MHOA are those health agents and health directors. There's an organization just for planning directors at the local level. Mass Public Health Organization works on a broad number of public health issues, and they're a good place to go to find out facts and supporting evidence. School superintendents have their own organization, as well as school committees. So a note on champions. So a genuine champion needs education, support, and a wingman. They oftentimes, like I said earlier, if you're dealing with a mayor's dealing with 14 issues in the course of the day, ranging from, who's taking care of the Veterans Day parade to a multi-million-dollar bond issue. So on this issue, you want to be the wingman. You want to actually, if they're going to be your champion, you want to be the one they turn to. I mean, if you've ever watched, West Wing or any show like that, the official turns their head to the person who's standing there with a pile of papers, and they have the answer for them right away. And that's kind of what you need to be. So things to be careful about, though, is that the opportunist champion that are just interested in your issue because it's election season. They want to get your topic involved in their election, which can be both good or bad. You can't always pick your champion, so sometimes you do get the crazy one. You might get the craziest person on the city council who's for you, and you need to still work with them. It's impossible to just ignore them, but you may need to shape their message. You may just have to be closer, working with them a little closer than the average counselor if you want to make sure that they don't go off the deep end. Same thing with the rogue champion, who may be with you on your issue, but actually they're using it to add another couple issues that they like to their agenda. So a note on elections and campaigns. I mean, it's not impossible to do this, especially at the local level. This makes a big difference at the local level. On your own dime, time, and phone, you can get involved. MMA, our lobbyists typically don't go to any fundraisers, but there are a lot of private lobbyists, for-profit lobbying firms that go to every single fundraiser, and it does make a difference. That aide to the state rep is standing right next to them, saying that, knowing that that lobbyist gave $500 last year. It could limit yourself to be involved because you could limit yourself to just get involved in the elections of officials that represent you, your state rep, your ward councilor, and that way you you may not be hurting your chances of working with other counselors who if you gave their opponent money, for example. And if you work at a non-governmental entity, such as a nonprofit, you may want to ask what the office policy is before you go off and do this. It is your right to do this, but you just may want to see what the parameters are. And then, this could happen that you have somebody in your office or your boss is running for election for a local official, for a local office, and so you need to figure out what to do then. Municipal timing. It is typical for city councils to hear the first argument for a policy, and the first thing that they'll do, if it's not really crazy, they'll just have a vote to send it off to a subcommittee. And it's where the subcommittees really do the most work. And that's where it gets hashed, the language gets hashed out if they want to go forward with it. It's where the language gets hashed out, the public hearings happen. And then in a lot of cities, by the time a subcommittee approves a policy and it goes back to the full city council, it's kind of de facto that it's going to happen. In towns, town meeting in Massachusetts is required by state law for the spring town meeting, and usually another town meeting happens in the fall as well. So be aware of when those town meetings occur and which you can get easily from the town's website, as well as learning the deadline for putting a policy into the hopper for town meeting consideration. And don't forget election season. So in Massachusetts, for cities, the election season is every other year in November, but for towns, it's usually a week or two before or after town meeting. So again, websites are very helpful to let you know when that happens.
We have a quick question, if you wanted to
Sure.
answer. Is it okay to meet with a public official or member of select board or town committee in a private meeting? Would that violate any open meeting law?
No, you can have a private conversation with any local official as a private resident. The problem that then happens is, say, it's when two counselors or two Board of Health members are having that conversation about something that's about a policy. That's when it happens. But a private individual and an elected official, no trouble. So when do you engage a local official? The quick knee-jerk reaction is, today we decided we want to do X. Tomorrow we'll meet with the mayor and see what he says. And so that may not be the best way to go about that. So you want to confer with others in the know, other people who work in city government, town government, or even just local activists who know the lay of the land better than you. If you are doing a campaign that's already happened, you best understand how it died, who are the key participants, what key participants were missing, and before you go forward. So that's helpful to know. And if you sense that consensus is going to be important, do you have this big blowout meeting where you have everybody attend, or do you do one-on-one? So those are going to be issues that are unique to the city or town. So for example, you might have an instance where a nonprofit has a breakfast and invites all the city councilors to talk about laying out a policy idea that you'd like to see go forward. That's a big jump forward. It's okay for the city councilors to sit there and all listen without violating the open meeting laws, as long as they don't talk about it amongst themselves. But that may be your one shot. That may be it. So if you went one-on-one, you may have gone to your champion first, and the champion tells you, okay, that's a good idea, but let's tweak it this way. And just to let you know that Counselor A and Counselor F, they're going to have problems with it in this way, but so just be ready for that. So those are the two ways that you can do it: individually, incrementally, or one big event. So mayors, everybody wants to meet with the mayor. I can tell you our mayor association, every construction company, state official, everybody wants to meet with the mayor, because we only have 50 statewide. What's good about them, if they're really on deck with you, they can actually force other people to the table. It's pretty easy for them to say to the head of DPW, to the school principal, I want you to attend, and that gets them to the Again, though, you have to confer with others in the know because they may say no. And again, don't feel bad if you have to meet with the mayor. Say there's no trouble at all. Natural champions at the local level, these are a couple examples. Snow-free sidewalks to kids walking to school. The Department of Public Works is obviously a natural to talk about this, and as well as the school superintendent. Setting up an opioid task force, you might have a counselor who is a substance abuse specialist, or a mayor like Mayor Walsh is in recovery, or a parent or a child with substance abuse disorder who has a really compelling story and is a local resident. Those things are great. Unlikely allies are those, the local official's personal story might compel them to work with you because, and that's why it's helpful to do some digging around to understand where they come from. It is interesting when you talk to the lobbyists that I work with here are from work on cancer issues and on lung issues and heart issues, and all three of them can tell you what state reps and what state senators have had cancer or heart attacks or strokes in their lives. but that's their job, so that's what they know. 6 degrees of separation happens really easily, even in cities the size of Boston. And so when you're in a smaller city, everybody does know everybody. It's amazing. So you really do need to learn your community. And don't say anything bad about anybody, because eventually, somehow it'll come back to you. If you're a newcomer to the city as well, just sit back and learn who's sleeping with who hates who's married to who. But it's best to kind of keep your mouth shut and go, that's interesting. Move on. So an example I just lived through, my city was on the verge of doing a very complicated intersection over where the bike path crosses. And out of the blue, there's a locksmith there who's complaining about customers won't be able to get into his parking lot with this new island that's going to be set up that helps bicyclists and pedestrians cross the street. So in the end, it happened pretty quickly, the solution, but you can see here that it takes a village to get something simple like this done. And so the planner and the ward councilor and the mayor's aide were all going to march up there and have a meeting with them and talk about it and try to hammer it out. But you can see how one small little wrench can screw this up, but fortunately the city quickly came up with a solution to go talk to them. What's the best way to contact a local official? Talk to people who are in the know, but again, get back to the FOIA thing. If you're going to put it in writing or an email, it is FOIA-able. And is that going to be an issue? There's a reason lobbyists still hover around the State House on phones because there's and that's not only do lobbyists like it, but politicians do as well. So there's nothing's in writing. How do you not just say, call me if you can, because then they may never get back to you. You want to move the ball forward, and you don't want 3 months later not having someone get back to you. So ask for a deadline, tell them that you're going to call by a certain date, or run into this local official at something locally happening, and that's actually not a bad way to do it. Local legislators at the state level, same thing, but they are much more likely to have an aide who is in the office full time, and don't be upset if you only get as far as the aide. But a lot of times, legislators have office hours in the district, is the term that they will use, where they have office hours in the town or city that they represent, and sometimes that's oftentimes it's better than going to the State House for a bunch of reasons. But you get bigger, better attention if you talk to them in the district. And a lot of them will set aside an hour or two once a month, once every other week, and I think a lot of times they're sitting there twiddling their thumbs. So having someone, it's a fine time to go meet them and have their undivided attention on your issue. Unless you are meeting them at a barn dance, feel free to overdress. I can't stand suits and ties. I'm hoping to go to my retirement without buying either one anymore. But it is better to be overdressed than underdressed. Thank them for any prior support that they have given you on this issue. Be aware that they will invariably talk about something having to do your issue, touching their life, or just randomly talking about their kids, because they have no doubt have a picture of the kids on this desk. There is no great way to stop this. So unfortunately, you can talk to registered lobbyists who've been doing this forever, and they're like, we had a 30-minute meeting with this state representative or state senator, and 20 minutes into it, he stopped talking about his kids or the marathon they just ran or where he went on vacation and started talking about your issue. There's no great way to control that, I'm afraid. But it's helpful to remember everything he says so you can use it in the future. Be precise, especially if you have only 10 minutes left, and get a sense if the local official you're talking to, the official you're talking to, is already like that. You can start the conversation halfway through. You don't need to give them the 101, but you can start at a more advanced level and save yourself some time. If you bring youth with you, it's a great idea to do so. Let the youth talk. They will listen better to the youth, but it's good to have obviously the adults in the room in case something goes awry. And they will always, if the local official doesn't prompt and want a photo to be done, feel free to bring your phone with you and offer to take a photo, because they really do love that kind of thing. Most legislators and some local officials do have ongoing their own pages, and so they love to add things to newsletters and to their webpage. In the wrap-up, it's easy just as don't walk out and be out of their lives forever. Ask if they need any additional educational materials, even if they don't. If they say, "Oh, I'm all set," feel free to send them something that came up in the meeting that's easy to read, that just might be interesting to them. Ask that you be their go-to person on this issue. Thank them for making the time to meet with you, and send them a thank you letter afterwards. You want to have as many touches as you can with that meeting, so that you become their go-to person and elevates your policy higher on their list of priorities. So in delivering this message, clear, concise messages, factual presentations. It's okay. This little graphic shows what looks like could be a PowerPoint. You're probably not going to have much chance to have a PowerPoint on a one-on-one meeting, but if you were to bring something like a laptop and had a really compelling PowerPoint or some really compelling a video to show them, that's not a bad idea, but keep it brief. Identify the community concerns that is specific to their constituency. Identify the benefits for them as well as their constituency, and follow up with any additional information. So these are two things that, this is a trick question. Which one will a local official read? In reality, probably neither, but if you want their aide to read it, send the 4-page summary. Don't send the whole report. If you really had a wonky person who wanted the whole report, you can get to, that's an additional touch that you can send them that report later, but do not expect them to read anything too heavy. Typically what happens with a select board or a city council meeting is the councils and the selectmen get there, say 30 minutes ahead of time. They go to their mailbox in city or town hall and they pull out about 3 inches of paper. And then they go to their desk and they sit down, and for some of them that's the first time they've seen stuff. So if you have a 334-page report, they'll be mad at you for filling their mailbox basically. But something that is concise and easy to read is what they'll look at. And colorful, big fonts, the whole bit. That's what they'll look at. And then this is what I just talked about. But your own executive summary is not a bad thing to do. So actually, an example of this is we're trying to get together a panel of people to come testify at two local hearings next week. And so one of the things I'm going to do is just put together a paragraph of the town and the city to which these hearings are in, talking about how big the city is, who runs it, number of Board of Health members, local what they've already accomplished in tobacco, and that kind of thing. Something really terse like that is not only helpful in my example for your advocates, but it's also helpful for local officials. So local data is best. The world is filled with offices filled with 3-ring binders and reports that never get looked at. So, so local is really good, even if someone who works on statistics winces when you say it. Sometimes that local stuff is better. For example, we did an Operation Bar Hop before the state went smoke-free. And what we did is on one particular night, we had, I think, like 20 teams of 2 people walk into restaurants and bars, and one stood there and counted the number of people, and the other one stood there and counted the number of smokers. And you went out and you just recorded it. It wasn't super scientific, but what it did provide to a local official is the broad reason for this was to show that not everybody smokes, that just 1 or 2 cigarettes can really fill a bar or a restaurant with smoke. But number 2, they could see the list. They knew that list. They had been in the 99 in that town. They knew Moe's Tavern, so they actually knew the lay of the land. It would have been far less effective for a Boston official to have read what was going on in Springfield. But when you had Boston, it made sense. And so that kind of thing where it's just a heavy, quick-hitting thing makes sense. And we have another town that's Juul has been in the news lately, the e-cigarette that has 70% of the market share in the United States. You know, we've been telling people, like, if superintendents and principals, take photos of your desk drawer filled with Juul. And when you say, as a random picture, that doesn't mean anything. But when you say, oh no, this was Malden High School, we just took it last month, and they go, oh wow, that's a lot, because they know the high school, they know the kids, they know this topic, and they're amazed that the principal has had to confiscate so many of these. Cities like cities, we do run into this funny world where our 351 fiefdoms don't think they're like anybody else, but in reality, they will ask. Cities will ask about other cities. Towns that look like each other will ask about towns that look like each other. So sometimes that's very helpful. For example, if you were in trying to do something in Amherst and you wanted about, say, student use of bicycle lanes, it would make sense for you to go to other university towns in Massachusetts and figure that out. So university town against university town makes sense. One issue we do run into is that we usually get a lot of data from high-end municipalities and lack data in those in-need municipalities. So Boston, just because of its sheer size, has a lot of local data. Nationally, New York City pumps out data beautifully. But a lot of times, New York City and Boston don't play in Seekonk, Massachusetts. so it is a difficulty to find like on like sometimes. And sometimes a unique out-of-state story does work, but I would caution you, the story shouldn't come from Berkeley, California, or someone like that. Public hearings, it is typical for city councils and selectmen to do public hearings. It's not always typical for like a board of health to do them. So the city council is really well run, and sometimes smaller boards, it's a mystery to them, and so sometimes it's a little less well run. But they do the hearings in all cases have to be posted according to state law, so the public knows they exist, and that in Massachusetts that posting has to be available 24/7. So it can be a website, or what most cities and towns do is actually put up a locked case, glass case on the front of town hall that lists all the cities, all the upcoming hearings and meetings in the state, in that town. Hopefully it won't turn into these 3 things. And this is what we try to caution, especially boards of health, not to do. Starting off with the easiest, a debate. So it's invariable that if you have the pleasure of counseling local officials on how to run a hearing, the first thing to do is tell them, do not answer any questions. Your job is to take in testimony, record it, and just say, we'll talk about it afterwards. Because invariably, the first person will stand up there and say, why do you hate convenience stores and want to ban blunt wraps? And the person's waiting for the answer. And it's tough for a board, especially a smaller board that's not a city council or a select one. They want to answer badly because it's their nature to do so. So we try to not have it be a debate, a fireside chat with just everybody's randomly talking, and then lastly a brawl. We have had some brawls in the state of Massachusetts over making restaurants smoke free, and the police have been called. So at the hearing, outreach to any resident that you can to give you input. If they're not a resident, but this is their subject topic, like they're really well known for that, that's great as well. You've got to know the proposal really well. You can't expect the 10, say you get 10 residents to testify on banning single-use plastic bags. You've got to be the person who really understands that policy in and out. You may have to jump in and say, when because the selectman says, well, what millimeter bags are you talking about? You need to be the person for that. And you can't expect the residents that you gathered to testify to know that. Evidence-based documentation, if you're going to hand it out, make sure it's simple. Track the testimony. Is very common. I write down everybody who talks at every public hearing, so you can go back and figure out who was who, what they said, and sometimes you can glean trends, or you start seeing people talking, like in the plastic bag situation. You might start getting retailers who are saying the same thing, and then you go to the site, some site that for Grocers Association, and it's like, oh, that's where they got it. This isn't an original thought of theirs. Additional rebuttal at the hearing is great, but if not, spark off a letter with any rebuttal that you have to get to that board as soon as possible afterwards, and always be thinking about possible acceptable compromises, especially after hearing, because you may have them come up and say, what has happened to us in the past is sometimes in like the tobacco, our regulation has like 40 moving parts. They'll obsess about some small thing and not even care about the ones that we really care about. And so if you can walk away from the hearing and say to the board, we're okay letting go of whatever the roll your own machine policy in favor of banning blunt wraps, that'd be great. Public hearing protocol. So this is something actually we hand out to boards of health, but this is something that you could write up for whoever board is going to hold the hearing that's on your topic, and it might be a helpful thing for them to know. It does get rid of some of this problems at the public hearing where people are saying, who are you, and who do you think you are, and how come this board gets to do this? And so this is a simple something for the chair to read out loud, and just it sets the tone for why the Board of Health is taking this under advisement. From the other side, this is if you are the advocate, this is something that you can put together. So again, this is tobacco, but it could be whatever, let me go back to my plastic bag example. How many retailers are there? How many of those retailers have plastic bags? How many of them charge for those plastic bags? How many have both plastic bags and paper bags so they can switch easily? I mean, those kind of things are very helpful to have right then and there. You'll look very impressive to a city councilor when someone testifying says, this is going to affect thousands of people in the city. For you to stand up and say, no, we already have 4 retailers that only use paper bags. 7 use both, and only 8 use only plastic bags. This is not that big a leap. You'll look like a star for the day if you're that ready. Finding allies. Here's a few places to go. I will say people automatically go to the Chamber of Commerce for issues that we've been dealing with. They're not always great, but your local Chamber of Commerce may be really good about it. So in Massachusetts, town meeting, outsiders need to get permission. It has to be voted on to speak. In fact, you're usually corralled. I've only been to one town meeting because it makes no sense for me to go to them. You'll get corralled into an area that of people who can't vote. And it's usually you'll be sitting with all the higher ups who've been hired by the town, like the superintendent, principals, people who live outside the town but have to be there for the hearing but can't speak because they're not from there. So in a town meeting setting, you really need to get residents down there to fill the seats and to talk. City Council, there may be a protocol to sign up before the actual meeting, so you should just double check with the city clerk about that. And handouts may need to be submitted before the hearing, so before the meeting. So for example, If Tuesday night is going to be the city council hearing on your topic, the previous, like Thursday, may be the last day that the city clerk accepts paperwork that goes into the packet for the city council. So you just need to be aware of all that. Stricter hearing procedures may exist, and sometimes it doesn't hurt to give a chat to the city clerk or the town clerk about that. And for boards of health, it's usually more casual, which has its pros and its cons, and trying to figure, and so they're the ones who really benefit best from that introductory paragraphs to read, because they can feel a little lost at a public hearing if they don't do it a whole lot. Training your testifiers is like corralling cats, but you can give it a shot. So avoid the local version of a form email. So I've been to hearings a long time ago when we were doing town by town, making restaurants smoke-free. And to have every person stand up and say, you know, my eyes get teary and I cough when I eat in a restaurant that's with smoking. After the thing differently is very helpful. And their personal stories matter a lot, especially for kids. You are talking to a board, a local board of people who've probably been out of high school for at least 2 decades. So they don't know what's happening at the local, in their high schools. They don't know what the mindset of a local teenager is. So it's really helpful for them to stand up and say, this is what I see in my high school. This is what we hear. This is what goes on in the boys' room, that kind of thing. It's all new to adults, and it's good for them to tell their personal stories. And then you also don't have to try and make kids memorize facts and data, but just telling the story is good. Passion is good, yelling bad. So do try to get your testifiers to stick to the time limit, to not just spark out the next idea that they have, like they're just sitting around the dinner table. If you've got a timid testifier, and you will, it is awful if, and we still have this happen, though. You'll have people come to a hearing. There'll be 3 people in the back that we can't identify. And the hearing comes and goes, and then afterwards we go out there and they're like, oh, that was a good hearing. The 3 of us are teachers or school nurses. We're glad to see this happen. And you're like, why didn't you just stand up and say who you are? Would have been just so helpful. I mean, it's nice that they came down to watch the proceedings, but just to have said their name, address, and I support this would have gone a long way. And if they're a kid, knowing what year in school and their school name is very helpful for those officials, especially for ward councils at the schools in their district. And for the really shy, there's usually a write-in period, but you need to find out if the deadline for the write-in period is the night of the hearing, or if there's a space of time, like a week or 2 after the hearing, for them to write in. If it's afterwards, what's nice is that if you have a shy person who's willing to write an email or a letter, that they could counter some of the stuff that your opposition was talking about at the hearing. This happens a lot, it's always been interesting in my world if the person hired to work on a policy at a local level is a townie or is new to the town. So if they're a townie, they already have built into them, like they know who's who, they know half the city council, but they also have built-in biases, and this one hates this one and this one hates me. But what I hear from people who are hired to work in a town that they don't know, they get this kind of like, I learned stuff too late. I don't even know that these things exist. And so there's going to be official ways that you can figure this out, and that would be the required posting of meetings. It's usually on the municipal website also. But it's also perfectly fine to say to the planning board, can you just add my email address to the list of people you already sent the minutes to or the agendas to? And usually they'll be happy to do so. And you ask the department heads on your committees or the chair of the board to keep you in the loop. For the most part, they're not out to get you, and they can't hide too much by state law. So it can be a challenge. And again, if you're on the good side of a city clerk or town clerk, that's a good thing as well. So you lost. You actually went up and you lost. So you didn't have the momentum. The timing was wrong. You're too close, too far away from an election. that's okay. Take a little time off, regroup your supporters, and talk about and figure out what went wrong. Talk to your champions about what went wrong and how this could be corrected in the future. It could have just been a bad timing thing. You could have been up against, your topic got shuffled off because the gym ceiling fell in the week before, and that's all. And people are obsessing about that. Think about talking to your local officials who oppose you to find out what would be amenable in the future on this topic. There may be nothing of great help there, but they will appreciate that you made the effort to talk to them anyways. And self-assess what you did right and wrong. It's sometimes you think, oh, I could have trained the testifiers better. I could have mixed it up a little there. I could have given more helpful handouts, or maybe just a little too early. Like the legal term is ripe. Is the issue ripe? Maybe it just wasn't ripe yet in your city and town to go forward with that. Any questions?
So we just preempted the audience that the question slide was coming up. So if any questions do come up as DJ is going along, please feel free to text them in the question box and in the chat box as well. Somebody asked if they could get the slides after. And we want to remind people that slides and resources will be sent along after the webinar takes place. So yeah, feel free to go along, and if any questions come up, I'll pop in again.
So I've thrown in a few examples. Complete Streets is a term that's used nationwide by planners and traffic transportation specialists. But in Massachusetts, we were doggedly trying to get cities and towns to put Complete Streets resolutions into place. And the idea was that it was to encourage cities and towns to regularly, when they're putting down new roads, or in Massachusetts where we are so already well paved, to when you're going back to fix a road, to include public transportation, pedestrians, and bicyclists in this. It was a slow slog, and we certainly had a lot of evidence in our back pocket to do so. But to say to a city or town, oh yeah, $40,000 extra for the countdown light at the intersection, sounds good, but it's And we talked to them endlessly about that high walkability raises house prices, gets you a more interesting mix of people moving in. But it wasn't until the Department of Transportation decided to fund programs to give money to cities and towns. And so it required that a Complete Streets bylaw, ordinance, or administrative policy be put into place. It had to be signed by the municipal CEO, chief executive officer, and for cities that's mayors, and in towns that's board of selectmen chair. And then it would go to the Board of Health, and Mass Department of Transportation to be approved, and then there were next steps that eventually led to cities and towns being able to get up to $400,000 a year to do these smaller fixes. Keeping in mind, $400,000 doesn't buy you much of a sidewalk, but it does do a lot in terms of putting down it crosswalks and that kind of thing. It helps. It helps a lot of times. It's these projects when the price goes up or there's some unexpected cost. It's those extras that get trimmed off just to meet the financial goal, and those extras are sometimes those things that affect adversely bicyclists and pedestrians. So they had to have a local hearing at the local level. They had to identify the body that was going to carry out the policy, have a baseline inventory of what was going to happen, and develop procedures for doing so. This was a fairly heavy lift for what is considered small money in the world of transportation. $400,000 is not a lot when it costs 10 times that to pave a mile of road in a downtown area. But once we started getting cities and towns to do it, we were able to get together sample regulations, sample policies for them to do, and make it a lot easier, and really pave the way for them to put this in place. And so a lot of them have, we really have met this goal really well. There's been a lot of improvements dealing with walking, cycling, and public transportation over the last few years that this is put in place. It's gone so well and there's been such a demand for it. The administration wants to keep on funding it. It's really been a win-win for everybody, especially for a state agency, Department of Transportation, that's usually very complicated for cities and towns to work with. So this was an easy way to do so. So as an advocate who worked on this, he had to convince cities and towns that it'll cost them no money. Then you had to convince them that it's not the same DOT you deal with every day that tortures you on a daily basis on big projects, that this was going to be a fast project. And we had a lot that did it, and what was really nice is that a lot of them got a lot of funding. And so one of the things that was very helpful as we started going down this path, we would keep this is an abbreviated list of what I typically would hand out, but we have 148 cities and towns that do this. So when you have cities and towns look at the list, they go, oh, well, if Acton can do it, so can we. And they appreciate what their neighbors have done or what similar cities and towns have done. And I gave what I thought was information on the bottom that would be pertinent to a city or town to say, yes, this makes sense for us to do. This makes sense for us. It gives us some comfort to move forward. And, if you never know who knows who. So the Beverly planning city planner may know the Agawam city planner, and they call each other and say, hey, you did this too? How did it go? And can I share some of the information? So for this, this is a prioritization plan is a very confusing document. But we tried our best to make it, again, getting back to this, giving local officials something simple, easy to see, what makes sense. Before and after the pictures were very helpful. Being able to say 2 towns over, they put in this little roundabout, it's working really well, really made a big difference. Showing, saying just generically, can we get $10,000 for bike racks throughout the city? City councils will. But if you show them these different bike rack ideas, kind of give them a map as to where they would go, show them, bikes that are chained to poles that you don't want them to be chained to. Showing that kind of thing, this kind of visual is very helpful. A second example is in Massachusetts. While we've have done a great job of banning smoking in public transportation, even some parks, restaurants, bars. The problem is that we actually have smokers out there who have absolutely no place to go. So they smoke at their house. But then, we have a 13% smoking rate in Massachusetts. So that means in an apartment building of 100 units, 87 don't, that's right, 87 of them don't have any smoking, and they're tortured by the smoke that comes into their place. So in 2004, we had this state law, and then all of a sudden, so we had this uphill battle with public housing officials who understood the pain and agony of having people smoke in their units, especially because when they went to go turn it over, they were the ones who had to rip the carpeting, paint the walls, assume the cost of that new carpeting. So they can see the problem. Then all of a sudden, the U.S. Housing and Urban Development came out and directed that everybody should be going smoke-free sometime in the future. So we were able to use that and ride that wave, much as we are right now riding the wave from tobacco on Juul because it's in the news. We were able to ride that wave and really convince a lot of local public housing agencies how unfair it was for non-smokers to have to put up with smoking by their neighbors all the time. That going smoke-free, we had a good plan, but having a 1 year before the effective date, offer in-house cessation, really do everything in the process to make sure that the policy, when it came to that effective date, that it would be effective, that it was working, that there was high compliance, and as a small benefit, to actually get some of these smokers to stop smoking. A third example, school vending machines. The goal was to switch out Coca-Cola for water, healthier drinks. But we first realized that a lot of times you don't know where these machines are. We had people working in city halls who knew there was a Coke machine in the cellar. Go down, there's no evidence who operated this Coke machine. And they'd walk around City Hall and say, I don't know who does it. The guy just comes and fills it. I don't know what happens. And so we first had to find out where the machines are, who holds the contract, how hard it was to switch those offerings. who buys what now, what would make sense to the people working in the building for healthier options, and who will fight you on this. So invariably, it's the that's not necessarily true that Coca-Cola will send a representative out, but they'll send out the guy who administers or fills up that vending machine and talk about lost revenue and that people in the building like Coca-Cola. So then you can talk about what would a compromise look like, and I thought I had. So this is a compromise, just jumping forward one. This is a compromise that the city of Boston did. They didn't ban it, but what they did is they did this traffic light thing to have people just stop and think about what they want, and slowly what would happen, the dream was that slowly you would get more and more people drinking the green Go drinks and stop drinking the red Go drinks, and then when the Coca-Cola guy came to refill them, he'd slowly realize that he could get rid of a couple of the high sugary offerings and replace them with something healthier. Just going back, this is the materials on these two things. You know, for public house smoking, it was helpful for our when we were trying to convince housing specialists at the local level to go smoke free, to show them sample lease languages from other towns that it was possible to do, to show them the federal press release that I'll show you in a minute. For vending machines, getting that list of where the machines are, getting photos of them. You actually may find out that you have far fewer than you realize. Now, it'll be an easier lift. Compile information into an easy read summary for your local officials, and they really will appreciate that. And if it doesn't look like it's going to be that heavy a lift, they might just be like, why didn't we just do this? So this is the CDC press release. So something this, so this is probably a page or two long, and unclear whether or not a local official would read it, but they will at least understand that it's from the federal government. They'll read the headline, and that will matter to them, and so that does make a big difference for them. So I think that's about it. I don't know if there's any questions out there. I don't even know what time it is either.
So we've got about 7 minutes left, but before we head you off to go, I want to let you know that we're going to be launching a couple of polls in just a second. We really want to hear what you think about this webinar, if you thought we achieved our objectives, if topics like this are useful for you. So please don't head out quite yet. I know sometimes once we start to get close to time, there's a mass exodus of people. So we would love to hear what your thoughts are. So in a second, we're going to launch some polls, but I just want to make a note of some upcoming trainings that we have coming up. The Prioritizing Youth Voice in Public Health Efforts is actually on January 16th from 10 a.m. to 11:30. That's our old date from last year, so I just want to let you guys know. And then also that we have a new health equity cohort that is accepting applications. They're open now, and they will end January 2nd, so please feel free to visit our website, hrainstitute.org, for more information on how to apply for those. So I'm going to hand it over to Kelly, who will launch our poll so we can get some feedback from you on how you think we did. And there's 5 polls, so we'll do this pretty quickly. So you'll see the first one up on your screen. How will you rate the overall usefulness of this training? Pick your selection, and as soon as we have most people voting, we will close it and start the next one. So rapid fire here before we end at 3:30. Give it one more second so you can get some more responses. All right. Thank you for entering poll number 1, and soon poll number 2 will launch. Here's poll number 2. How would you rate the trainer's level of knowledge and expertise on explaining this topic? Choose your answer, and we will record all the feedback because we take it very seriously, and it'll help inform our trainings for next year. All right. Next poll, the trainer was able to describe how engaging stakeholders, community members, and elected officials in my work can promote PSE change. And again, these are going into the objectives that we were set out when we scheduled this online training. So if you feel like we met that objective, please feel free to fill that in. Great. Next one, the trainer was able to explain how to strategize ways to leverage local data and community voice in town meeting spaces. So pick your answer and we'll do one more, I think we have, and then we should be good to go. And finally, our last poll, the trainer was able to name strategies for presenting at a town hall or board meeting. Thank you for most of you for hanging in there with us and answering our polls. Again, we take your feedback very seriously and we hope that you can join us for our next training that we have coming up in January, prioritizing youth voice in public health and public health efforts. And again, if you want more information about any of the things mentioned today, please feel free to visit our website, hriainstitute.org. Oh, and if you are part of a Massachusetts coalition, I want to let you know that we are doing a Mass Coalition update. We are the only entity in the state of Massachusetts that has a coalition database of all the coalitions across Massachusetts. So if you are a member of a coalition or a head of a coalition, please go to our website, update your information so you can be a part of our network. All right, that is it for us today. Again, we hope you have a great afternoon and thank you so much for joining us. Thank you, DJ, for leading us through all of that great content, and we hope to see you next time.